Hey Tandem family, we're here today to talk about the hip. So there are 3 common diagnoses that could interfere or cause pain in the hip. One of them is hip bursitis, which is inflammation in the bursa, just right here. One of them is hip osteoarthritis, which is the joint itself is kind of wearing away. And then the third one is called piriformis syndrome, where the piriformis muscle that is deep in the glutes is inflamed for a myriad of reasons. First thing we're going to address is hip bursitis, and we're going to do a strengthening exercise. We're going to do a clam against the wall. Let's move against the wall. Be laying up against the wall, hips up against the wall, feet against the wall, and you're going to do a clamshell. So you're going to raise your knee as high as you can, hold it about 1 second, and come back down. So you're going to strengthen the muscles of the gluteus medius and gluteus minimus. Keeping your hip against the wall prevents you from compensating. Going up as high as you can, it gets a little shaky, coming back down. 3 sets of 8 is a great repetition. Now, coming back to the floor, for our piriformis syndrome, we're gonna stretch the piriformis. And so that is a figure 4 stretch, bringing your ankle right over the distal part or the farthest part of your quad, parking it there, pushing the knee down towards the floor, and then leaning forward until you feel a stretch deep in your glute muscles. You're gonna hold that stretch for 30 seconds. And I would recommend doing it 3 times. 30 seconds each. Should be a good feeling stretch. This is called the figure 4. And then the last stretch / range of motion movement is for hip osteoarthritis. So these are called windshield wipers. So you're going to have your legs suspended over a surface, sitting in a chair that's a little bit high. Keep the top of your leg in contact with the surface you're sitting on, while you move your foot as much as you can towards your other leg. Again, not shifting so much in the top leg, just from the knee down. That's external rotation. And then you're gonna move your foot as far as you can away from your other leg into internal rotation. And you're going to sway in and out of those positions, external to internal, rotating the femur, essentially, and creating some flexibility in the joint that is showing signs of arthritis. Those are windshield wipers for the hip. Have a great day.